Okay.
There, I got it. Okay.
Yep.
Good morning, everyone. Thank you for joining us this morning. Today, we continue our Wednesday HR webinar series with Tommy with the Gano HR Group. Today's topic, when employees test positive for COVID. Mr. Gano is him and his team have become very well versed in this area. So there's a lot to cover. And before we get started, a couple of webinar housekeeping rules. We ask that everybody please turn off their cameras and mics to help us save bandwidth and lessen our chances of video freezes and getting disconnected. Please utilize the chat function available at the bottom of your screen. Cindy will be, or Tommy will be stopping periodically to ask questions during the webinar, and Cindy will take care of the chat function down at the bottom. So, or if you'd like to wait till the end, we will have an open mic Q&A. Also, if you're having any trouble hearing us or seeing us, any kind of technical issues, please log out and then back in, because that seems to help the connection. That being said, it's all yours, Tommy.
Thank you, Ms. Audrey. Good morning. And everybody hear me okay?
Mm-hmm.
Sound test, yes. Good morning, everybody. So this is going to be an interesting presentation because we've done a very similar presentation in the past and had to change a couple of things. If time permits, we're going to try to use as many examples that we've encountered as possible. We highly encourage you to please ask questions. We're going to try to reserve some time at the end and open the mic for questions. You don't have to obviously mention names, name of the company or anything like that, but just, I have an employee that is not positive, but living with somebody that's positive. Employee tested negative 2 times, but has all the symptoms. What do I do? There's going to be, I'm sure, different situations. If you don't have them, we will talk about them because we've encountered a lot of that. To Audrey's point, because of the fact that we represent so many different industries, we get numerous calls on a daily basis, and so we'll anything COVID related, like I said, we'll open it up towards the end. Okay, so please do not be shy because obviously this is very, very important. So everybody see the presentation? Yes, good. Okay. So the topics that we're going to discuss today, there's not many, but they're going to be in great detail. So first, we're going to talk about the requirements. Okay, it's not just employee test positive. Now what? Well, before anything, you need to be aware of the requirements, because even as we hit now 8 months into this COVID pandemic here in El Paso, employers are still faced with the confusion. I don't understand. Why does it apply to me, not apply to me, et cetera, et cetera. I don't want to do it. I don't care what they tell me. I mean, we've heard it all. So first and foremost, let's talk about these requirements. Number one, the poster far left is the FSCRA poster, which is the one that the Department of Labor required every employer to post as of April Fools of 2020. Okay, this poster should be in a conspicuous space. This poster has to be posted so your employees are aware of their rights. And we have had several calls where employees will say, I was reading the poster and I want to inquire how I would qualify for FSCRA. Okay, your requirement is to just post it. If you're not familiar with the FSCRA, reach out to your human resource, reach out to your attorney, reach out to us, and we can guide you on that, okay? That being said, that poster, if the Department of Labor gets a call, the first thing they'll ask is whether or not you have posted that. If not, they can come in. They're not going to go in person right now because they're also being quarantined, but they will note you as a non-compliant. They will actually note it on their records that you are not complying. They can even ask you to send a picture of your area where you have your bulletin boards or whatever, where you have to comply with the law. Okay, the one in the middle and the one in the far right, These are health and safety policies that the city, the county requires employers to do, okay? The health and safety policy, if you do get audited by OSHA, and by the way, OSHA is going in person, and they're looking at your protocols, they're getting complaints, they're sending these letters out to you, they are showing up, and of course, these health and safety policies will help you fight any OSHA complaint, that you are in compliance not only with the FFCRA, but also with the health and safety policies. The one in the middle is for your employees. The one on the far right is for visitors, customers, contractors, vendors, et cetera, okay? So we have these posters and we can provide these to you in English and Spanish. But don't just post, make sure you follow, folks, the requirements of the poster. These posters will talk about, you know, whether you are actually doing any type of questionnaire, whether you're doing temperature checks, the requirements, the masks, all that good stuff, PPEs that need to be met before they come into your building, okay? So that is gonna help you, again, fight any type of audit, possibly even litigation if an employee says they contracted it and you did not take any steps necessary to protect them. So any questions on that? None, okay. So let's get right into this. The employee tested positive, now what? So I'm gonna give you the general terms, but if you wanna stop and ask questions, definitely do so. Send a quick chat. If you wanna, you know, turn your mic on or unmute yourself and ask the question, we're open to that as well. Because this one's gonna, in my point of view, is gonna be fun. Just because of all the different scenarios that are happening. So we are probably going to have 99.9% of the answers, but if we don't, we want you to ask because we're going to also inquire ourselves and get an answer for you. So the first thing is when an employee tests positive, your job is to ask these questions, okay? You have a total of 5 questions here. First thing is you should have this documented, have a sheet, you should already have a folder with these questions, and then you write in the answers, okay? Obviously, you're not gonna have the employee in front of you. If the employee says, listen, over the weekend, my wife or my significant other tested positive, and I went to go get tested, I'm not going to come into work because I believe I'm going to test positive because I have symptoms, or I did test positive and I'm not coming to work. Don't just hang up the call and that's it. You have to ask these questions. What is your job title and responsibility? Okay. I know that that's the obvious thing, but keep in mind that some of you that are here may be HR professionals that are not dealing with these people hand in hand, and you may not know who they are. So you need to ask those questions, job title and responsibilities, okay? Why do we ask that? Well, first of all, we need to know whether this is a person that goes out on the field, whether this person actually does are they in the office with multiple people? Are they in close contact all the time with their subordinates? Those questions have to be asked. Next question, how do you believe COVID-19 was contracted, okay? You need to ask that question, and this is a very important answer, because if they tell you that and for the most part on our end, oh, well, I went to my aunt's house this weekend, we had a get-together, that's the number one answer, folks. You know, we had a get-together, and because of our get-together, several of my family members called and said they were starting to feel sick. I think I got it. So if they tell you that it was because they actually think that their coworker gave it to them because one of their coworkers tested positive and you're not aware of that, you need to follow that thread. You need to, ask which coworker you're talking about. Obviously, you keep that confidential and you go from there, okay? Ask them your work and non-work activities and possible exposure that led up to the diagnosis. So what were you doing? If he says, well, I was working with this person and we, during our lunch, he invited me to to go pick up something. I got in the vehicle. We did let put our mask down as we were eating in the vehicle. You need to know some of those details, okay? Then, of course, the fourth question here, and one of the most important is, how did you come in close contact with it at work? I'm sorry, who did you come in close contact with at work, okay? Important. Close contact, folks. 615 rule. Just probably maybe a couple months ago, the 615 rule was within 6 feet for more than 15 minutes altogether, right? Now it's 6 feet, within 6 feet, 15 minutes cumulative, meaning in total throughout the day, if they had more than 15 minutes cumulative, 5 minutes here, 5 minutes there, within that day, the work day, that is defined as close contact, okay? So those individuals that they name are the ones you are gonna have to speak to, and we'll get into that in a little bit. Next question, do you believe a company is taking the proper precautions to prevent COVID-19? Also a very important question, because you need to know whether the supervisors are following the directives, whether they're, requiring their subordinates to wear the PPEs, all of that stuff. It's important to know through your employees whether or not the supervisors or the company in general is following COVID-19 precautions, okay? Again, very important that you document these responses, folks. Put the name of the person. Again, this is for you, HR professionals or business owners. You have to keep this very confidential, okay? Keep it in a folder, COVID-19 folder, if you will. COVID-19 positives, you put it in that folder. Questions, you pull it up if you need to, if you ever get audited. So very important that you document the responses. Quarantine. Now here's, again, you used to hear the 14 days, and now you hear the minimum of 10 days as recommended by the CDC, okay? So keep in mind that it is very important that the 10 days as recommended by the CDC, employees are gonna start telling you, because some of them abuse the FFCRA policy, their benefit, and they're telling you now that they want to come back to work because now they're not getting paid. Okay, so what do you do in that situation? Obviously, you have to let the employee know that they need to follow the guidelines. We need to know whether they have symptoms. We need to know whether they have a negative test result. So we're gonna get into the return to work, okay? You quarantine them for at least 10 days, and then if they start bringing you these letters from the CDC, well, the city of El Paso, the Department of Health, stating that they can return to work, which is happening very often. We need to ensure that this is something that we follow consistently based on your return to work policy. Any questions? No, Cindy?
So, yes. There's a question. Do you need to provide both a doctor's note and a negative test result, or will one or the other be sufficient?
Do you have to provide a doctor's note or a negative test result? So I'm going to talk about that right now. This is the important piece of this, is that you have to have a policy, number one, of what you want to do, okay? When I say what do you want to do you want to actually have your employees complete a 10-day quarantine and a negative test results? If that is your policy, then whether they have a doctor's note saying that they can return, that they're no longer contagious, if they don't have a negative test result, you cannot just go based on the doctor's note, okay? Repeat the question again, Cindy, I'm sorry.
So question number one, right? Doctor's note and a negative test result together,
Good.
right? And I'm assuming in order for the employee to return, or will one or the other be enough?
So again, in some cases, and we'll talk about this, the quarantine period, this is a very difficult question to answer, folks, because we have clients that they don't care whether they are positive, as long as they meet the 10-day rule, okay, employee has no symptoms, and it's in this presentation. So if they have not had, according to the CDC, according to the city of El Paso, if they've not had any fever within the last 24 hours, okay, without the use of medication, they say they can return to work. And at least 10 days since the symptoms first appeared and the symptoms have improved. So they bring you a doctor's note and you ask them, have you had any fever in the last 24 or 48 hours without taking any medication? Okay. And the answer is no, no fevers, no cough, nothing, no symptoms. Then it's really up to you to allow them to come back to work. Keep in mind that they may still be positive, okay? So that's an important tool here, because that's gonna change your way of handling the way you deal with your staff, okay? Just be consistent. The only thing that we ask of you folks is you have to be consistent. If you're not consistent, you're going to get yourself into a situation, employees will actually start asking why you're not allowing them to return to work, why you're allowing your best friend to return to work, et cetera, okay? Did I answer your question?
I'm going to say yes, but if they have additional questions or need clarification, they can re-ask or whatever. The next question is...
I'm going to just step away. I'm going to hear you. Go ahead.
Okay. Is the 615 minute a policy or a directive from the state? And I was going to tell them, Tommy, that, you know, it's a combination of both, I guess, because the CDC, both CDC and so the CDC specifically states the definition of social distancing is 6 feet. Okay, so anytime you're going to implement a policy, you need to state that there needs to be the 6 feet social distancing between employees, right? And that there's a requirement of the mask being used. Again, I've told some of my clients, if they're in an individual office space with 4 walls or what have you, we've had clients who have gone to the point where they even put a sign at their door. And employees will say, do not enter until you're invited to come in, right? Because I need to ensure that you've sanitized, that you've put your mask on, things of that nature. Again, that'll be, you know, that's people being creative with ways of protecting themselves. But I'll let Tommy finish up with the 615. It's a combination of both. So yes, it's state and CDC. So go ahead,
Okay.
Sorry.
So again, I'm just going to go back to the first question. So folks, I'm going to tell you our recommendation. Our recommendation, because this is a very complex situation. The city of El Paso is telling your employees, you can return to work, you've already passed the 10 days, okay? Then OSHA comes in, and if they come in, they're going to start asking you and to substantiate yourself. We've done several OSHA responses already, and the most common one is you're exposing your employees to employees that are still positive. Okay, some employees, I don't know why they feel that they want to flex their muscle and saying, oh, you know, I've already been gone through the quarantine period, but I'm still positive. COVID didn't do anything to me. So they start speaking, and your employees that are at work, they're afraid because this person says they're still positive, and they're not going to feel protected just based on the fact that they brought a doctor's note. Our human resource recommendation is wait for a negative test result. The city of El Paso is telling them, we're not going to retest you. You're possibly going to be positive up to 90 days. Okay, we had a case yesterday. I had a call from a client that an employee 2 months later is still testing positive, still has trouble breathing, okay? But they told him that he can return to work. So the reason, according to the doctor, is because this guy's a smoker and says that's going to be a long-term effect. Okay, so do you want to return this person back to work because you have a doctor's note that says he can return? In my professional and even personal opinion, you wait till the negative test result, okay? You have protections under certain state or federal. CDC says one thing, OSHA says another thing, EEOC says another thing. So what our attorneys have been telling us is forget about all of that. Protect your employees. I'd rather you protect your employees than to be sued because, one, you didn't protect your employees, and possibly, if that person does speak to somebody, does have any interaction with a coworker, that coworker gets sick and ends up in the hospital, possibly even dies, then what are you going to say? Well, the CDC said this. Well, they're also saying recommendation that after 10 days. Okay, they're not telling you you are obligated as an employer. So keep that in mind. I hope I answered the first question. The second question, you said the 615 rule, the policy. Yes, it's according to, just what Cindy just said, state, CDC. That policy, that directive is something that when they call you and ask you and they want to do the contact tracing, that's the question. I ask them, talk to me about contact, close contact, 615. Now it's 15 minutes cumulative, okay, not consecutive, but cumulative. So it's more difficult now because were you in front of me for a minute, and how many times was I in front of you? Well, 15 times. Okay, well then chances are I'm going to be considered a close contact, okay? So any other questions?
Yes, so just to kind of recap, so again, there's people that are HR directors and different levels of expertise, right? And again, when you're implementing those policies, the question is do we have to require them, right, to have a negative result in order for them to have to go back? It's not a requirement that you would say it's a state requirement, that's a mandate. Again, just to piggyback on Tommy's response to that is you establish those internal policies yourself, right? If you're going to require one negative, then it's one negative for all that are caught or, you find them in that situation. If it's two, then again, that is a policy you'll write internally. But like Mr. Cano said, the consistency is the key here, right? Because you're going to have positions that may be a little more needed in a sense, or a little more of importance for the lack of a better terminology. And you can't have someone who you are in dire straits of having returned to work not test negative, and then have someone else who's maybe an office, data entry clerk or something, require them to do something different from everyone else. But again, sir, it was how many negative results the employees need to have to go back to work?
Yeah, I mean, one is enough. Two, it's up to you, but just make sure you practice it consistently. That's the most important thing is you practice everything consistently. You do your return to work policy. So going back to the presentation, and we'll go through some of these questions, folks, but the quarantine, again, the minimum of 10 days, if you want to follow that. The return to work, establish a COVID-19 to work policy and be consistent, folks. Must provide a doctor's note saying that they're able to return to work. These are just examples. Must provide a negative test result before returning to work. If you want to do a double negative, it's really up to you. Will allow employee to return to work if no longer symptomatic and receives a letter from the city or doctor to return to work. Whatever your policy you want to do, establish the return to work policy, do it consistently, have it in writing, make sure everybody else, depending on how big your business is, if you have department heads that are making their own decisions, make sure you circulate this policy to all of them and ensure that they're following it consistently. Not because their best employee, favorite employee, they could return, et cetera, et cetera. Just keep in mind, what am I going to do to make my staff feel comfortable? Because that's what is happening, and we've seen it, is the employees say, I'm not working under those conditions, I'm going home, okay? I'm high risk, and you're bringing somebody back only because they met the quarantine period, but they're still positive? No way, I'm not, and here you go. Do we fire this person? Can he or she contact OSHA and say they have a positive employee working? Now you have to deal with OSHA. So look at that and make your decision, okay? But again, put them in writing. Again, these two examples at the end, at least 24 hours have passed since last fever without use of medication, and the no more symptoms after 10 days, okay?
Before you move forward, just because this is still going to be based off of what we were initially talking about right now. There was a comment made and on the chat where there's a specific entity that is requiring one negative result after a quarantine and one from the doctor. We have to be careful with that because not everyone has access to doctors. So if you're going to require that, you'd have to really, really look into because you don't want to disable your employees either and not allow them to return to work. Because if you're going to require that, then you may have to pick up the cost for that exam since the company is the one initiating that requirement, and you may have employees that are not insured. So
Correct. Yeah, be very, very careful with your practices, folks. I mean, I highly encourage you to run this through your HR department. Okay, they're the ones that are going through all these trainings. If you don't have one, again, contact your attorney. Nobody really is a COVID-19 expert. Even 8 months into this, we consider ourselves to be very fluent in what's been happening. But we do get hit with a different scenario almost weekly, maybe. So we've got the experience, but then again, just like when we think we've got it under control, the CDC or the city will pass or somebody changes another protocol. Again, the 615 rule. So contact tracing, now let's talk a little bit about that. Once you complete the questionnaire and you need to notify the employees who were named as close contact. You must notify them. Do not say, you know what, I'm not going to tell anybody because I need my cook, I need this person, otherwise I'm not going to operate. Do not put yourself in that situation because you can have a cluster, and whether you like it or not, if you do have a cluster, then the city's going to come and shut you down, and OSHA is going to impose fines on you that, you know, you probably won't be able to handle because now you're closed for business. Close contact employees should follow the quarantine orders. Okay, now, the quarantine orders that we talked about, the 10 days, here goes into, again, a different avenue. Can you require them to get tested? If you do it after 4 or 5 days. It's what the CDC is saying now. Do not send them immediately unless they say, I was in close contact with Cynthia on Thursday, which already been 4 or 5 days later, then yes, go send them and to get tested. But definitely tell them you were considered close contact. You need to get home, go get tested, okay? And hopefully, again, the 4 or 5 days have already lapsed. What if they test negative? Follow your return to work policy. The only thing I can tell you is follow your return to work policy. Have 4 or 5 days already lapsed since the person that came in close contact has been out. They tested negative, no symptoms. If you want to put that in your return to work policy, do so. Okay, make sure you follow that. Determine if you want to notify all your employees as recommended by OSHA. OSHA tells us you don't notify your employees, you're not notifying the employees. Okay, when that happens, we tell the OSHA investigator, we are notifying those that were named as close contact, okay? But you can and you should possibly notify your staff, look, we had a positive case. Only those people that this person named as close contact are the ones that are being quarantined. If any of you voluntarily want to go get tested, that's up to you, but you are required to come to work unless you become symptomatic, unless you're not feeling, you're feeling sick the next day, okay? If you're not, if you're asymptomatic and you were not close contact, you're required to come to work. But if you want to go get tested to give yourself peace of mind, go ahead and do so. Do not name the employee. Do not, I mean, by default, they're going to know, but do not say him, her, just say an employee tested positive and only people that came in close contact are being sent home. You are just being notified out of courtesy, but you are required to come back to work, okay? But again, follow your return to work. Explain to staff only if the employees were named to close contact. Like I said, depending on your industry, you can send the employees to go get rapid tested. There are a lot of these rapid testing sites that are popping up now, which is good. And you know, you can ask them. They're mobile sites that are coming to your location. They charge you. I think the lowest that we've seen, and if any of you have seen anything lower than that, you can say so. But the lowest we've seen is $99 per employee for a minimum. I think it's 5 employees. Cindy or Brenda, you can correct me if I'm wrong, but minimum of 5 employees. Okay, $99 and up to, we've seen as high as $190. Okay, for rapid tests. Test results anywhere between 15 and 30 minutes, definitely within the 8 hours. Okay, so keep that in mind.
Yeah, There's a couple of new sites or parking lots that are, a new company came in to do rapid tests that don't require appointments per se, and you get results in 10 minutes, and you don't need the 5-employee minimum, right? But it's a new company that opened up. So, I mean, if you all need that information, let me know.
Yep. So who's going to pay for the test, folks? Okay. If you are requiring the employee to get tested and do a rapid test, you must pay for the test. Okay. If the employee says, because we've had a situation where we rapid tested the close contact employees and other employees started getting upset and saying, why did I not go through the rapid test? You're discriminating against me because, you know, I'm not getting rapid tested. I want to get rapid tested. Mind you, it's a cost to the employer. You can tell the employee you can get rapid tested, but because you were not named close contact, we're not requiring you to get rapid tests. So you can pay for it yourself if you wish, but you're not required if they voluntarily want to get that rapid test. Okay. But if you require them, again, you have to pay for that. Any questions?
There was one question which we answered through the chat. Again, this is if we ask close contact employees to quarantine, do we have to pay them? And the response is, if they were named in a contact tracing due to exposure within the office and due to work, and you're asking them to get tested, the answer would be yes, if they haven't already exhausted the hours that they would be eligible for per se due to the FFCRA, according to whether they're part-time or full-time.
And we're going to talk about that right now as far as the pay. I'm going to try to cover all this, folks, and again, we'll stop in some of these questions, but I know a lot of these questions are extensive answers, so I don't want to lose track of the presentation, but we'll do, hopefully Audrey will give us a couple extra minutes afterwards as well, okay? So we will get to your answers, but just real quick, getting into that conversation, test results. And I actually, you know, the topic here says tested positive, prove it. You know, because we get these calls from the business owners and they're telling us, well, they have to prove it to me before I pay them. No. So can I require my employee to provide test results? Okay. You're going to hear a slew of yes, no's, maybes. You can't, it's illegal, you may, whatever. So I'm going to give you hopefully the solution here. The Department of Labor that governs the FFCRA, okay, the paid sick leave, you cannot require an employee to give you a positive test result for you to pay them under the FFCRA. Now, the FFCRA, and we're going to cover that towards the end, anybody under 500 employees are required unless you are an exempt employer like a medical facility, and that is also defined in the regulation. That was updated recently. The FFCRA requires employers with less than 500 employees to pay that paid sick leave up to 80 hours, okay? But you can pay, if you do the average in the last couple of weeks, they work 30 hours a week, you pay 2 weeks, which is 60 hours. Okay, if they work 35 hours a week on average, you pay 70. It says up to 80, so you only get the tax credit, which will cover up to the 80 hours. But the important piece here is they don't have to prove it to you. If the employee says, I came in close contact with somebody, I'm going to quarantine, I want to get paid under the FFCRA because I saw the poster, okay, make sure you get something in writing from them, a text message, an email, something that says that so that you can cover your tracks when you are asking for the tax credit, okay? But only in that circumstance, you pay them the FFCRA because they're quarantining, they're waiting for the results. If within 3 days they get a negative result, you still have to pay them for that waiting period, okay, those 3 days. Do not pay out all 70 hours. You only pay those 3 days. If they work 6 hours a day, you pay them 18 hours. If they work 8 hours a day, you pay them 24 hours, okay, so on and so forth. The Department of Labor also governs the FMLA, so I'm going to get into that. And of course, here you have another entity, a federal agency, the Equal Employment Opportunity Commission, which is the EEOC. They cover the Americans with Disabilities Act, and we'll get into that very briefly. Again, I just mentioned about the FFCRA. You're not required to, your employee to provide you with documentation. The employer may not require the employee to provide test results to receive the paid FFCRA, like I mentioned, okay? Because you will likely ask for a tax credit, the IRS has also weighed in. Now we have another federal agency that says they've weighed in on the records that you should have. And this is what they're, according to them, going to require. Number one, name of the employee. So when you're paying it out, you're going to have the name of the employee. Obviously, document the FSCRA as such, FSCRA paid sick leave. The date or dates for which the leave was requested, okay? A statement of the COVID-19 related reason the employee's requested leave and written support for such reason. I'm taking care of my son, daughter, wife, husband, because they tested positive for COVID. That qualifies under the FSCRA. A statement that the employee is unable to work, including by means of telework. So if you have other people teleworking and you, under the FSCA rule, be careful with this, because if you have others teleworking and you're telling the employee, I don't want you to telework, I want you to exhaust your FSCRA, that's illegal. If they can telework, then they are going to require you to do the telework, okay, before the FSCRA. Now, I don't want to get too much into this detail, but you may have both. You may have intermittent FSCRA. I got a call from a client late yesterday that one of the employees tested positive. She's feeling somewhat okay. She works a couple of hours, and then she starts feeling very exhausted, and she wants to sleep. So he says, do I allow her to take 2 hours of work, telework, and then the rest is FSCRA? The answer is yes. Okay, so do not just count those 8 hours, because if they're working for 2, you have to pay 2 regular hours, and then the rest 6 hours under the FSCRA. FMLA, again, I'm not going to go into great detail on this, but under the FMLA, you're not required to provide, you cannot require, rather, the employee to provide you with documentation for FMLA purposes. If you're going to run both concurrently, which you can, if you're going to say, I'm going to put you on COVID leave and I'm going to provide you with FMLA paperwork, you can provide the FMLA paperwork, have them go to their doctor, have them, scan, fax, whatever, the doctor. If they ask you, can you fax this documentation to my doctor? You need to do that, folks, okay? Because obviously the doctors are saying, if you're COVID, positive, do not come into my office. That's what's happening right now. You fax that information to FMLA, have the doctor complete whether or not it is considered a serious health condition, okay? And then send it back. If the doctor says, no, mild symptoms, can recover at home, not considered serious, do not count it as FMLA, okay? But do not require the employee to provide you with a positive test result, okay? Or a letter from the city saying, this person needs to quarantine. Do not do that. Just give them the FMLA paperwork and let it just kind of run its course, okay? Again, you can run concurrent, but do not make that decision. Because the city tells this person you have to quarantine, that does not define FMLA, okay? Do not misclassify the FMLA. Be very careful with that. If you have any questions on this, it's very detailed, and I don't want to take too much time on that. That could take the whole hour to explain, but we're definitely available to you. My staff will put up the emails and phone numbers as well. Now, the EEOC, which was the last one, under the Americans with Disabilities Act, the employers may require test results to ensure employees may safely return to work by testing negative. So the EEOC does allow you to do that, okay? And so that they may undertake other critical measures, such as contact tracing and deep cleaning. Somebody tests positive, you have the result, you go in and do deep cleaning, especially in the area that the person was working. More specifically, the EEOC has issued guidance stating that employers may require employees to undergo COVID-19 testing before they return to work. So the EEOC is the one that protects you. OSHA loves this because you're not allowing a person with still positive that may have already exhausted the 10 days, not symptomatic. That's better because you have that negative test result. Just be careful with the DOA and OSHA requirements and explain to your employee why you're requiring the test and the results. Okay, do not tell them, well, I need you to bring me back a negative test result, and if you don't give me any results, I don't know that you're lying to me. We are getting these conversations. We are hearing this a lot. I'm not going to pay your FFCRA. No, that's illegal, folks. So other employees now want to quarantine. Again, I'm not going to cover this too deep because we've already talked about this. Only people in close contact stay home, okay, until either A, they bring you a test result that's negative and are asymptomatic. The employees that tell you, which is the second piece right here, the employees that tell you, I want to stay home because I'm not going to work somewhere where somebody tested positive, you're not taking any precautions. Yes, we did. Overnight, we had somebody come in and disinfect the whole building, the whole office, restaurant, etc. You need to report to work, okay? No, I'm on a quarantine. It is my right. If you do not report to work, you are not close contact, you're not asymptomatic, fear of COVID is not going to protect your job. You don't report to work. If you have a policy that after 1 day or 2 days of no call, no show, they are going to be considered to abandon the job, then so be it. That's what you do. Okay, you need to let them know that. Okay, so how do I pay an employee that is out for COVID-19 reasons? Your FFCRA poster should have that information, but nonetheless, this is information that we present or provide rather to our clients. It's pretty simple, folks. They got to meet these requirements, number one, okay? An employee that says, I am afraid, I'm going to go get tested just out of precaution, so I'm going to quarantine myself. If they don't meet 1 through 6, that person is not paid under the FFCRA. If you ask them, well, did you come in close contact? No, but I'm just playing it safe. They do not meet that requirement, folks. Okay, you need to keep that in mind. Do not just start throwing out the FFCRA, because if you misclassify it and they really need it in the future, that's going to create a problem for you. So make sure they meet the requirements of 1 through 6. If you're somewhere in the gray area and don't know, then you need to go with one or the other, okay? Play it safe, go to your HR, go to your attorney. If it seems like it's not 1 through 6, then let them know it doesn't meet the requirements. If it seems like it is, then play it safe, get something in writing from the employee, and go ahead and pay it, okay? For reasons 1, 4, and 6, a full-time employee is up to the 80 hours of leave, 1 through 4 and 6, okay? For reasons number 5, the employee gets is eligible for 12 weeks of leave, 40 hours a week, but we're going to talk about exactly the calculation, okay? But just keep that in mind. Reason number 5, that taking care of your child is up to 12 weeks. The first 2 weeks is under the paid sick leave. The next 10 weeks is under the EFMLEA. So keep that in mind, okay? What kind of pay are we talking about? So for reasons 1, 2, and 3, it's up to the 80 weeks, two-week period, up to the 80 hours rather, no more than $500, $511 per day, or total $5,110, $5,110. They get their full hours paid for reasons 1, 2, and 3. For 4 and 6, 2/3 of their pay, and also for reason number 5, 2/3 of their pay. Okay. Again, this information is available to you through the DOL.gov website and even through your poster. So make sure you look at that. Okay. Under the tax credits, again, if you're going to be paying your employees, make sure you classify it as FFCRA, and you make that classification aside. Talk to your CPA, talk to your accountant, and let them know, of course, that you want that classified as such, because in 2021, when you're asking for the tax credit, they're going to ask you for all the proof, of course, and you need to have something. No, not just, well, I think I paid Johnny 80 hours. Go ahead and throw that in for, tax credit purposes. So it's extremely important that employers receive the note from the employee's healthcare provider advising them to quarantine. It's important to do that. But again, if they don't want to provide it, we get these calls where employees say, I didn't get anything in writing. They called me over the phone. I don't doubt them, because the city is overwhelmed, especially right now with all the cases that we have in El Paso. Okay, do the best you can. Get a text message saying, I tested positive. They called me and told me that. Save that, put it in the file, rather than not have anything at all. Okay. Under the OSHA requirements, am I supposed to report COVID cases to OSHA? Very simple. The only way a COVID-19 case would be reportable to OSHA would be if the employee passes or is hospitalized as an inpatient overnight as a result of COVID-19 contracted from performing work-related duties. If they do it on their own, if they contracted it on their own, a family gathering, they went out of town, they went to Mexico, wherever, and they contracted it, that's not your responsibility, folks, okay? It's only when you know they reported it because it was work-related that you have to meet this criteria. The normal criteria for reporting severe injuries applies even to COVID-19 cases. Employees must report any work fatality within 8 hours, okay? So you should know the basics of the OSHA, but for COVID-19 reasons, unless they contracted it at work, then that would be the only reason to report it. And this is a form that you need to complete, the OSHA 300A, and that's also something that's available on the website, okay? So we're gonna cover a couple of things, frequently asked questions. I wanna give ourselves enough time to cover some of the questions that are popping up. Can an employee put in a claim for unemployment if they are working on reduced hours? The answer is yes. An employee can always put in a claim if they're working less hours because of COVID reasons, because the workload is not there. If they quit, they were fired really at any time, it's their right to file a claim. Whether they get it or not, that depends on the on the state, Texas Workforce Commission. Do not tell the Texas Workforce Commission, I want to deny it. You can tell them all you want, but they're going to ultimately make that decision, okay? If I'm paying them under the FFCRA, can they still put in for unemployment? Yes, but report to the unemployment how much they're receiving and for what. They're not supposed to double dip because FFCRA is considered a wage. So when you do get the unemployment claim, you can respond, a person is on quarantine because of COVID reasons and getting paid the FFCRA. Do not, folks, tell the employee, look, I don't have money to pay you under the FFCRA. I don't want to pay you the FFCRA. Just go ahead and file for unemployment. You can't do that. If they're going to unemployment, I shouldn't have to pay for the FFCRA. Yes, you do. FFCRA is law. You have to pay that. You cannot tell them, I want you to use your paid sick leave. I want you to use your vacation. You have a lot of hours before the FFCRA. You cannot do that. If the employee tells you that they want to do that, that's up to you, but you cannot require them to do that. Again, do not require them for paid sick. Do not require them to take their sick leave, their vacation, company-based, company benefit, or unemployment before the FFCRA. FFCRA goes first. What should I do if one of my employees is confirmed to have COVID-19? We covered that. Most cases do not need to shut down your facility, but do close off any areas. Disinfect, do all that you can to show your employees that are still there that you're taking all the steps necessary, okay? During this waiting period, open outside doors and windows to increase air circulation as well. That's important. If employees have been exposed but are not showing symptoms, should I allow them to work? Remember what we talked about that. Exposed employees who have symptoms of COVID should self-isolate as well as those who do not have symptoms. All other employees should self-monitor for symptoms and wear cloth face coverings when in public. If they develop symptoms, then they need to notify their supervisor and stay home. When should an employee suspected or confirmed to have COVID-19 return to work? Again, folks, we covered that piece. Make sure you develop that return to work policy. Should we be screening employees for COVID-19 symptoms such as temperature checks? That is optional. If you do have a screening protocol before they come into work, make sure you document it. Make sure that you do it consistently. Make sure you assign a person to be doing that up front. Don't have that person be walking around and do the questionnaire when they've already been working for an hour or two or three too late. It's usually when they come in, okay? What can I tell my employees about reducing the spread of COVID-19 at work? Follow the policy and procedures. Remember in the beginning, we showed you the health and safety policy. Make sure you follow those procedures. If you have an additional policy on top of that, great. Stay home if you're sick. Practice social distancing. I was in a meeting earlier today, and they were specifically talking about that social distancing, and they're seeing that people are just not following that social distancing. You know, they're still in front of each other, and because she doesn't look sick, he doesn't look sick, they're even, you know, taking off their masks because they can't breathe, whatever the case may be. That's the number one thing, is make sure you still follow that social distancing. Coverings, the masks, PPEs. Employees should inform their supervisor they're feeling symptoms. Encourage your employees. Look, we need to know whether or not you're symptomatic. I've already used my FFCRA. This is happening a lot, folks. I've already used all my FFCRA, and I cannot afford to take leave without, pay. So that is creating a problem, and that's creating spreads within the workplace because of that reason alone. Make sure they wash their hands often. Use hand sanitizers. Avoid touching their eyes, nose, and mouth. That's important. Give them that. Try not to do that. Wash your hands first before you start. Even if you've been in your office by himself, have hand sanitizer, put it all over your hands. And if you're itching, try to use maybe even your shirt, but if that happens, you don't know somebody sneezed in front of them and they have it there, just tell them, wash your hands before you touch your face. More importantly, to the extent possible, avoid touching high touch surfaces, elevators. If you have an elevator in your office or to get to your office, you need to use an elevator, try to use the steps, stairs, whatever. Do that as much as possible on your end, and people will follow what you do. Minimize handling cash, credit cards, and mobile. You've seen that in the restaurants. Now they're even, they put their little machine out the window and have you insert the credit card and take it out. They don't even want to touch your credit card in some cases. And avoid all non-essential travel, of course. Here's some additional resources: cleaning and disinfecting your facility. Disinfectants for use against COVID. There's a lot of different resources out there now because of 8 months of this. There's a lot of resources. So we've got about 6 minutes according to my clock, but I'm sure that we can probably have an additional 10 minutes if Audrey permits us to do that, so that we can cover as many questions as possible. Let me open the chat. Go ahead, Tim.
Okay, so again, I think we need to kind of reiterate or clarify the doctor's note and the negative test, right? So there's a question: employers should not require a negative test or doctor's note for return to work after confirmed COVID. I was responding, but it opened up for Q&A, so I stopped.
Employers shouldn't. I'm sorry. Was that an answer?
So the question is, it's a question: employers should not require a negative test or doctor's note for return to work after confirmed COVID. Does that sound better? Does that sound like a question?
Yeah. Okay. Sorry. It sounded like you were giving a directive. Should not. Okay. So again, the EEOC allows you to require the employee to provide a negative test result before returning to work. Okay. And the city is probably going to tell you, no, I'm not going to do it. You as an employer, you have the right under the EEOC based on the Americans with Disabilities Act. Okay, you can require them to test and come back with a negative test result because the EEOC will protect that right. Okay, so yes, you can require them. The only thing, again, is consistency, folks. You got to do it for everybody. Well, this employee is more important than the other one, so I'm not going to require them because they're still testing positive. They're still testing positive. Follow your return to work policy, and if you have it in there, then they have to do so.
Okay, so the comment behind the question is that that's what's listed on our presentation slide. But I think the reason that it's listed in our presentation is for the sake of, because some doctors and some services are so inundated, the FFCRA states that you shouldn't, how can we tell you, it cannot be a conditional that you have to return to work. Tommy will elaborate on that.
No, so again, the FFCRA doesn't care whether you keep your employee out or not. The FFCRA is just regarding the pay, whether they get paid while they're out. The DOL, nobody's going to require you to return them to work. The city will tell them you can return to work, but they're not telling you. The city's not contacting you, folks. I've not heard of any city representative, Department of Health, when I say that, or CDC telling the employer, you have to let them come back to work even though they're still positive. So you're not required to put them back to work after 10 days if they're still positive. You can require them to test negative. Okay. I can open the chat and
there's one more. Our company policy states that if an employee is sick or absent for 2 days, 2 or more days, they are required to provide a medical release to return to work. If an employee is out for positive COVID 10 or more days, are we okay to ask for a medical release since it is in the normal policy that the employee signed?
Yes. You can require them to provide you at least a medical release from a doctor or the city to return to work. You can do so. It's just like the negative test results. You just cannot use that as a tool to not pay them, folks. And you cannot use that as a tool to put them on FMLA either. Okay, but yes, you can require them to provide your doctor's note to return to work. In reading some of these chats, did we answer I have a vendor whose employee has at least 3 days and symptoms and more than 14 days going. Did we answer that, Cindy? Okay, I don't think we did. I have a vendor whose employee has at least 3 days since symptoms and more than 14-day quarantine who still tests positive. He states he was directed not to continue testing for a negative result as he could test positive for a long time and he's on the job out with clients. Okay, so this particular question or comment is more in line with, again, 10 days. Have they met their 10-day? Are they symptomatic, not symptomatic? Have they had a fever? If you allow them to come back to work, then, according to the city and according to the CDC, they're in the clear so long as they maintain social distancing, so long as they use their PPEs. Okay, make sure that your policy specifically says that. If you do return without a negative result because you're not symptomatic, because you, in the last 24 or 48 hours, you've not had any fever, and again, without any medication, and it's 10 days have passed since the last your positive result. Okay, if they meet those requirements, but they are doing PPEs, wearing the mask, keeping their social distancing for more than 6 feet, then you should be okay. If they're not, if there's no way that they can do that because their contact with the client is within, they almost have to touch maybe a physical therapist or whatever the case may be, then that changes everything because they cannot maintain that. So now you can require them to test negative. Okay.
If we know,
Go ahead.
If we know an employee is traveling out of the state to visit family for the holiday, or that an employee tends to frequent a bar/restaurant, is there anything that we can do to prevent this from happening during COVID?
Well, bars and restaurants, if they frequent that, if you cannot prevent them, to answer your question, you cannot prevent them from, you cannot control them, you cannot track them, you cannot put a GPS on their phone, on their vehicle and see where they're at. You just can't do that. We're hearing some of that, younger employees, they know they're probably not going to pass, if they're not going to get it severe, and they're still going to the bars, still going to restaurants. We say restaurant bar because of course the bars are still closed, right? But you cannot, there's nothing you can do about that. Only, monitor symptoms, only monitor, go through the questionnaire. Have you had any cough? Have you had any fever? Let me take your temperature. That's the only thing that you can do at this point. I know there was a question. I'm an HR director and we follow strict guidelines. And if you adopt a strict policy and wait for a negative test from a doctor, this is a best practice. And it's not a question. It's more in line with what we're talking about, folks. We recommend that you have a negative test before they come to work. But you, as an employer, you may have those, or I can't afford that to happen. Let me see. The requirement of the negative test result would be a decision you, as an organization, would make. That's Cindy's response. Absolutely, be consistent with all employees. Did we answer that one, Cindy? How many negative tests has the employee need to have in order to come back to work? Yeah, we did answer. I think we said 1. You're on mute. You're on mute. You're on mute. You're on mute.
Forgive me. Sorry. All the questions have been answered. The only thing pending is there was a request for the FFCRA, the 3 posters that were presented at the beginning of the presentation. The FFCRA, you can access that through dol.gov. The safety and the health and safety policies, we can send those out if you all provide your emails, hence the reason why there's a couple of emails on the feed.
Very good questions, folks. I mean, we still got, Audrey, do we have an additional 8 minutes?
Yeah, we can go an additional 10 minutes.
Okay. So I'm going to, I promise you that I will talk about some examples, folks. In the meantime, if you still have questions that you know, you're trying to put together, go ahead and ask. If you want to mute yourself and ask, because it's faster that way, go ahead and ask. But and it's okay to interrupt me, but I'm going to give you one particular case that Cindy and I were handling yesterday. We have an employee who the employer says their return to work policy is, you know, they're going to, well, let me rephrase that. They don't have a written return to work policy, even though we've, you know, sent them one, even though we've recommended one. Their practice is, well, if the person is negative, I'm going to tell them to come back to work, even if they have to quarantine. I'm going to tell them to come back to work after 10 days. Okay. In this case, somebody else jumped in who is above that person that made that and said, well, if they're negative, they tested negative, and even if they're living with somebody who's positive, but they tested negative, we need them back to work, even if they have not exhausted the 10 days. So it kind of opened a can of worms. Here's kind of the kicker here. The female employee, her husband is positive right now, and her 2 children, son and daughter, are positive right now. Son and daughter have pretty strong symptoms. Husband, mild symptoms. She tested negative twice, but she did the test on the same day, which was 6 or 7 days ago. Okay. That is pushing the employer to say, well, she needs to come back to work. Here's the thing. As we were talking to her, Cindy and I were talking to her yesterday, she sounded sick on the phone. In fact, she was sneezing, coughing, and she sounded very congested, mormada, okay? I asked her, you know, symptoms. She says, Mr. Cano, I have not been able to get rid of my headaches, okay? I've taken 800 milligrams, I think, and she says that
ibuprofen.
ibuprofen, and I still have my headaches. I don't feel 100%, but I am 100% sure that if I do report to work, even though I tested negative twice, but again, mind you, it was 6 or 7 days ago, I will feel that guilt if somebody else at work gets sick. It's an office. It's not, she doesn't work out in the open. She says, I would feel extremely guilty if somebody gets sick, and we have older people, obese people working there, people with possibly health conditions that I do not want to expose, and I do not want to come to work until I test negative. Can they please wait at least? She's testing today, Cindy, I believe it was.
Today.
And so the employer,
Today.
her boss is saying, no, you need to come to work today. This was yesterday. She said, you need to come to work tomorrow, which is today. So we had to reach out to them and say, look, this is not a wise decision for you to require them to report to work. So, you know, it's kind of it's one of those anomalies, right? Because here she is tested negative. She feels symptoms. Everybody else in the family is positive, but she's tested negative twice. Was it too soon? In my opinion, yeah, I think she tested too soon, et cetera, et cetera. So we got to make sure that you understand what you're dealing with, folks. Return to work policy is one thing, but there might be a scenario, a situation that'll throw you off a return to work policy. So just be consistent, be careful, listen to them, lend an ear. Don't be, you know, demanding to report to work. So, you have other questions?
Nope.
If a new employee worked 2 days and says he went drinking with someone who is positive, are we required to pay?
Oh, wait, I didn't see that one. Oh, so you caught it before I did. Where? Maybe that one was sent to you personally because, oh, there it is. No, I don't have that one.
If a new employee worked 2 days and says he went drinking with someone who is positive, are we required to pay? If the new employee worked 2 days and he went drinking with someone who is positive and they're now required to quarantine, you are required to pay. Okay. Unfortunately, the FFCRA does apply to that person. I assume that this question comes from somebody that has less than 500 employees and that is not a medical provider. Okay. Unless you're exempt from any of that, you're not required to pay, folks. If you have more than 500, or if you have, if you're in the medical industry, if you're a medical provider and you fall under the exemption, you do not have to pay whether they've been working 2 days or 200 days. You're not required, but other than that, you definitely do. Any other questions?
Not on the public one. I don't know if you have any privately.
I think that one did come in privately, but. This is, again, you were talking about the posters. Make sure, folks, that you have these posters. Make sure, the most important thing out of this training is, A, know your requirements, your pay requirements, because the Department of Labor is calling, they are calling us saying, I don't think your client is paying under the FFCRA. We have to tell them they have more than 500 employees, and they back off. So I know they're calling for sure. Know your requirements on your pay. Know your requirements on the health and safety policies. Know your requirements on the return to work. You know, establish it. Talk to key people, HR, attorneys, owners. You know, how do we compile the return to work policy? Ensure that department heads are following the return to work policy consistently. Because again, you don't want to allow these employees that are feeling a symptom, or even if they're asymptomatic, but they have not met the 10-day quarantine because they were exposed, you don't want to allow them to return to work just because they're your buddies. So consistency. If you have any questions, if you have any concerns, I think that we'll receive. Will we receive Mr. Cano's email? Yes, I'm going to put my email. Oh,
I just did, Tom, but I didn't capitalize your first letter. Sorry, forgive me.
No, you don't have to. And here's my direct line, folks. Okay. Email me, call me. I apologize if I don't get back to you immediately. I have my staff because I need their help. But just understand that we are dealing with a lot of changes. I'm going to suggest to Ms. Audrey that in the near future we do another presentation because of the fact that they're very, very moving targets. So we'll try the best we can to stay on top of things and present them to you as we go along. We had a good turnout today. I think we had more than we've had in the past. Very good questions. I know this one these are the most relevant because of the fact that this is happening now and El Paso is saturated with COVID. So stay safe first and foremost. Thank you all, and we hope to see you next week. Cindy, you have another question?
I do want to make a quick comment before we say goodbye. Is you'd like, you can CC any of us with emails that you're sending, Mr. Cano, and that might help expedite your responses, only because Mr. Cano gets inundated, right? And you might get a quicker response, right? We're all on the same page as far as what information we're providing. So if you all want to CC us, by all means do so, and then we might be able to get that response out to you a little quicker.
Absolutely.
That's just a recommendation.
Ms. Audrey, you want to close?
All right. I think that's it. Can you stop the recording, Tommy? Thank you, everyone. And one thing I wanted to ask you, Tommy, do you think next week's webinar will be a continuation